A student may be able to identify an abnormal blood pressure, recognize an elevated temperature, describe the signs of infection, or list the symptoms associated with a particular disease. A nurse who has spent years caring for patients begins to put those individual pieces into context. The blood pressure may not be concerning by itself, but perhaps it has fallen from the patient's usual baseline. The temperature may not be dramatically elevated, but the patient has also become unusually lethargic. The patient who normally eats well has suddenly refused 2 meals. The family member who has been calm throughout the hospitalization has become unusually anxious. Each observation may appear insignificant when considered separately. Together, they may tell a very different story. This ability to connect information is one of the defining characteristics of developing nurse brain. From information to understanding. Nursing requires an enormous amount of information. Nurses learn medications, laboratory values, diagnoses, procedures, treatments, precautions, policies, equipment, documentation requirements, and countless details specific to individual patients and healthcare settings. The amount of information can feel overwhelming, particularly early in a nursing career. With experience, however, information begins to organize itself. A medication is no longer simply a name with a dosage and a list of side effects. It becomes connected to the conditions for which it is prescribed, the patient's other medications, the patient's laboratory results, potential adverse effects, and the changes the nurse should watch for after administration. A laboratory result is no longer simply a number outside a reference range. It becomes part of a larger clinical picture. A change in behavior is no longer dismissed as the patient having a bad day. It becomes a question worth investigating. This transformation is important. The experienced nurse has not necessarily memorized every possible piece of information. Instead, the nurse has developed a mental framework for determining which information deserves attention and how different findings may relate to one another. Nurse brain allows a nurse to move from collecting information to interpreting information, from tasks to patterns. Early in a nursing career, much of the day can feel like a series of tasks. Assess the patient, take vital signs, administer medications, complete treatments, document, answer questions, reassess, communicate with the healthcare team, move on to the next responsibility. These tasks remain important throughout a nursing career, but experience changes how the nurse approaches them. A seasoned nurse does not simply complete an assessment. The nurse compares what is being seen today with what was seen previously. The nurse notices whether the patient is moving differently, speaking differently, eating differently, breathing differently, interacting differently, or responding differently to care. The assessment becomes more than a checklist. It becomes an opportunity to recognize change. This is why experienced nurses sometimes notice something before they can immediately explain it. Their brains have accumulated thousands of observations and outcomes. Similar situations become connected. Certain combinations of findings become familiar. A subtle change may trigger recognition because it resembles something the nurse has encountered before. The nurse may not initially know exactly what is wrong, but the nurse recognizes that something deserves attention. That recognition is valuable.